Dr. Martino, after we diagnose dysphagia, how do we manage a patient and treat a patient with dysphagia?
Well, we're lucky in this area. As a field, we are expanding very quickly on options on management and treatment. Patients today are having more options than patients, say, even of a few years ago. When we think about how to manage dysphagia, there are two different options, big envelope options. One is to compensate for the swallowing problem, and the other is to actually treat it. So let me talk about the first one. When we talk about compensation of a swallowing problem, we're really looking for a temporary solution, changing the environment, changing the food that the patient is getting, changing a posture that the patient takes when they're swallowing to help direct the food from the mouth through the throat and away from the lungs and down into the esophagus and safely into the stomach. So, what are some of the strategies that when I talk about these temporary strategies, compensatory strategies? One can be encouraging the patient and recommending that the patient sit up when they're eating, take small sips and small bites. That helps protect and direct the food down through the throat and into the esophagus. Another might be to change the texture of the food from, say, a liquid to a thicker liquid, so it's a slower moving food. This gives the muscles enough time to respond and direct the food down into the throat and then into the esophagus, again, keeping it away from the lungs. And sometimes it's asking the patient to do a head maneuver, like a chin tuck, bring the chin down to the chest. And that simple position change will help protect the entryway into the lungs and close it off so that the food or the bolus goes into the esophagus. So those are compensatory strategies. They work only if they're applied appropriately and only when they're applied. But they don't change the swallow itself. So the other camp is what treats and changes the swallow with the intent of not having to do these treatments in the long run. So one is exercises to strengthen the oral musculature, the muscles of the mouth, the muscles of the throat, so that they can control the food, chew the food well, and control the food as it's going through the mouth, through the throat, into the esophagus, and again, keeping it away from the lungs. So those muscle exercises are quite exciting because we're getting more and more research. Our lab is involved in a lot of this work as well. It's like going to the gym, but now it's not for the body, it's for the muscles related to swallowing specifically. And we're seeing that patients who execute these exercises regularly, consistently, actually have advantages over those who are a little bit more lackadaisical with regards to doing these exercises. There's also, it's not just the exercises alone, but it's when the exercises start that we're beginning to understand matters. Up until now, we've known the value of rehabilitation, coming in and fixing the swallowing problem after it's already started. But now what we're learning is that there's more value in starting the swallowing therapy early before the patient gets head and neck cancer surgery that, of course, disrupts the swallow. So prehabilitation is now becoming an increasing focus in what we're offering our patients.
Well, this is exciting, this concept of prehabilitation and rehabilitation, not just before surgery, but before radiation treatment
Yeah.
as well. I should also mention, as we talk about treatment of dysphagia, that if, for example, it is secondary to a head and neck cancer, then treatment of the cancer can obviously impact the dysphagia as well.